Why India needs Samrakshan? India has one of the worst perinatal mortality rate in the world. Out of the 12.8 crore live births in the world, 3 crores, nearly 23% occur in India. Out of the 2 crore low birth weight babies, India contributes to nearly 40%, that is 81 lakh babies are born in India. Out of the 28 lakh perinatal deaths in the world, India contributes to nearly 7 lakh, that is 25%. And one of the major reasons of the high perinatal and neonatal mortality rates in our country is the hypertensive disorders of the pregnancy. The Samrakshan and IRIA initiative aims to reduce this perinatal mortality rate of India. In the developed countries, the prevalence of hypertensive disorders is between 1 to 5%, while in India it is reported from 8 to 25% in different geographic areas with an average prevalence of 8 to 10%. So we have a very high and a significant incidence of pre-eclampsia. In our country, the incidence of Down syndrome is 1 per 800 to 1000 live birth, for which we do the first trimester screening for NT, spending nearly 15 minutes to half hour. The incidence of congenital anomalies is around 20 to 27 per 1000, for which we similarly spend half to 1 hour, while the incidence of hypertensive disorders of pregnancy is around 80 to 100 per 1000. How much time do we spend to do the screening for pre-eclampsia? Or rather, do we perform pre-eclampsia screening? We have more cases of hypertensive disorders than congenital anomalies and Down syndrome. And do we really give justice to our pregnant population? Are we screening for pre-eclampsia? Or are we neglecting our mothers and fetuses? Just for introspection, out of the 30 million children born in India each year, 3.5 million are premature births, 11 to 14 million are FGR fetuses, while only 0.6 to 0.8 million are fetuses with congenital anomalies. Screening for aneuploidy and congenital anomalies is absolutely justified, but at the same time, we should ask ourselves, are we really doing anything for screening for pre-eclampsia, screening for the hypertensive disorders? And that is why the project Samrakshan was initiated by IRI. Samrakshan integrates fetal imaging studies with childbirth planning with the focus on pre-eclampsia and fetal growth restriction. So under Samrakshan, a systematic phased approach is designed to guide radiologists in India for pre-eclampsia and FGR screening using ultrasound and color Doppler at 3rd month and at the 8th month. This helps to identify high-risk pregnancies.
The woman identified as screen positive for pre-eclampsia and FGR is started with low dose of aspirin, that is 150 mg of aspirin per day given at the night from 14 till 36 weeks.
The aspirin trial has shown that low aspirin reduces the risk of early onset preeclampsia by 80% and the term eclampsia by 60%. Not only this, low dose aspirin started in the first trimester in screen positive women is associated with a significant reduction in FGR, reduction in the severity of preeclampsia and severity of PIH, and also the preterm births. So let's see how the Indian scenario of perinatal mortality will change if we start preeclampsia screening at NT scans. So total pregnancies in India is around 30 million. Out of this, approximately 8%, that is 24 lakh, are at the risk of preeclampsia. If now preeclampsia screening is done in all the pregnant ladies with the help of maternal characteristics, the mean arterial pressure and the uterine artery PI, we are able to identify around 82%, that is 20 lakh of the patients who may develop preeclampsia. And 80% of these 20 lakh women, that means 16 lakh women, will have a great benefit with the help of this low dose aspirin. We will be able to save life of 16 lakh fetuses. Samrakshan suggests that no growth scan should be done without multivessel color Doppler, including the uterine, umbilical and the MCA flow evaluation. Color Doppler in growth scan not only help to differentiate small for gestation fetuses and the FGR fetuses, but it also helps staging in the fetal growth restriction, and thereby this stage-based protocol guide us for appropriate follow-up and help in the decision of proper delivery. Timely delivery at an appropriate place will help the survival of the baby, thereby reducing the perinatal mortality of India. So we need to focus on India-specific conditions, India-specific data, trimester-specific data and childbirth outcome. And hence IRI appeal all radiologists to join Samrakshan and start filling online Samrakshan form to plan our own strategies which will help to reduce the perinatal mortality rate of our country. Thank you.